All righty. Good afternoon, Roquell and Soula. How are you all doing? Dr. Wyche, I didn't want to put it that way. How are you all doing this afternoon? I don't see
Doing
Soula.
great. Thank
Good,
you.
good. I'm glad that you all could join us. And I think the video is very clear, but we're all wearing red today. And so I'm going to start by saying, why are we wearing red? What is the message we're trying to convey to people throughout the community that see us in this beautiful red? Sula,
Well, I do want to thank you for rocking your red.
thank
And
you.
also, I want to say that February is my favorite time of the year, specifically because it's American Heart Month. And this is when we really want to spotlight heart disease because it is the number one killer for all Americans. And so during Heart Month, we really want to try to reinforce the importance of heart health. And then also, we want to really get people to understand that the things that they do every single day, the healthy habits that they do, are going to help improve their heart health and help them to live longer. So we're really working with our Go Red for Women campaign so that we can empower women to take charge of their health.
We acknowledge this every February. Can you all tell us what's happening? Are the numbers getting better? People actually getting the message of like the video that we saw a few minutes ago, things that we need to do to protect our hearts and make our hearts better. Are folks getting the message?
Denise, they are getting the message, but with the advent of the pandemic, I think it's just become really harder and harder. People's stress is up, and I think it's been, people are not moving as much and doing some of the things they have to do. And I'm with Roquell. February is my favorite month of the year. And, the theme for American Heart Month is reclaim your rhythm. And we have that theme because we want to empower women and we want to give women and people a chance to be proactive. And we're doing it through music. You heard it in the video. Music can transport us to a whole different area. And so we want people uh, to take control of their lives, to reclaim their heart health. And that's what this month is all about.
That's great. That's great. And Dr. Weiss, talk to us about, I want to stay on the positive. I definitely want to do that. I definitely want us to talk about, as Soula talked about, rhythm, music, exercise, moving, reducing stress. All those things are great. But when you focus on cardiovascular disease, and so tell us really what that is and why does it affect women more than men?
So cardiovascular disease includes heart attacks, it includes strokes, it includes high blood pressure. So really, cardiovascular disease affects more than just the heart. And when it comes to African American women, ages 20 and older, 49% have some type of cardiovascular disease, which is surprising. And it's really quite unacceptable because when you really think about it, out of every two African American women, one of them will have cardiovascular disease and starting at a very early age, as early as age 20. And this is completely unacceptable, mostly because 80% of all heart disease is actually due to uncontrolled risk factors. So if we were able to control these risk factors, 80% of heart disease would just disappear. And so this is why our focus is to get women to understand that this is their number one killer, and then also to understand what are the risk factors and how can we best control those risk factors.
How does it present itself, though? I mean, because, we feel a lot of things, during the day, during the year, throughout our lives, in our sleep, when we get up in the morning, we feel things, but a lot of times we just ignore them. And if we're only doing a once a year physical, it's something could show up, I guess, in between. So how does heart disease present itself?
For women, a lot of times it can be atypical symptoms. So men, we know they get chest tightness, very textbook, feels like an elephant is stepping on their chest type of symptoms. But women may have symptoms that are much more subtle, and so women are much more likely to dismiss them. So even something as simple as just having chest tightness or even just an uncomfortableness in your chest. It can be either side of the chest. It doesn't necessarily have to be the left. It can radiate to the jaw, to the neck, to the back. Having unexplained dizziness or nausea, feeling hot and sweaty can be either cold sweats or hot sweats. All of those are symptoms that are much more subtle that might be missed by women. Having shortness of breath that is unexplained, or shortness of breath that occurs earlier than what you would think for your level of exertion. Any of those are things that you need to address immediately. So you should be calling 911 if you have any of those symptoms. Women typically hesitate because they have so many things going on. Women are trying to be super women, and they just don't want to take that time to say, okay, I need to take care of myself. And that's one of the things we really, really want to emphasize. Women need to know the signs and symptoms, and they also need to call 911 if they think, or they think a family member is having a heart attack.
Before I bring Soula back, Dr. Wyche, one of the other things is, you know, we know that there are disparities that exist in healthcare, and we know sometimes people may feel certain things. They go to a physician, and doctors, I think I've heard this before as it relates to women, sometimes just, you know, make you feel like things are in your head as opposed to what's actually happening. So how can women advocate for themselves when they are really concerned about, you know, a situation or a condition that the doctor seemed to take, may not take as seriously as the patient wants them to? How do you handle that?
This certainly does happen. And I've had many women tell me they had symptoms, actually went to the emergency room and then got dismissed several times before they actually had their heart attack. And so women really need to advocate for themselves. First, starting out by knowing your numbers. So when I say know your numbers, when you go to your doctor takes your blood pressure, he gets lab work, and he says, okay, everything is fine. And then you leave. But really, women need to know their numbers. They should know for high blood pressure, they should know what their blood pressure is. They should know what their goal is, 120/80 or less. If they're not at goal, then they should be talking with their doctor saying, how can I get to this goal? The same thing goes for cholesterol. You should be getting your cholesterol checked on an annual basis and then saying, if my HDL, my good cholesterol, is not where it needs to be, what should I do to get it to that range? When it comes to diabetes, you should be checked for diabetes. If you have it, you should be trying to keep your numbers below a certain goal. And that's something you should be talking with your doctor about on a regular basis. Tobacco use, the number is 0. You need to talk with your doctor if you smoke so that he can help you get some solutions for smoking cessation. And then also maintaining a healthy weight. So if your body mass index is above a certain number, it makes that so that you're either obese or overweight. You should be talking to your doctor specifically about, how can I lose weight? How can I get into a more healthy range? And if you do have any of those symptoms and you go to the emergency room and they say, well, we think you're just having anxiety, you should say specifically, I would like to be tested for heart disease. I would like an EKG. I would like a stress test. And empowering women to say, these are the things that I would like, and so that I can have heart healthiness. And I think that's what's most important.
I am so glad that this program is recorded, because you gave some very great instructions, I believe, helpful instructions for people who need to know what to say, because sometimes they get into that doctor's office or the emergency room, and they're just sort of at a loss for what to ask for. Thank you so much for that, Dr. Wyche. Soula, we're, you know, you talked about music, you talked about rhythm. What can folks do in the community to really support the message of the American Heart Association to reclaim our rhythm, as you say, and protect and maintain healthy hearts?
You know, everyone can participate. There's a ton of information on our website. We have local programs, and we have lots of local free programs. Tonight at 7 o'clock, you can join on Facebook Live, the DMV Links program. It's going to be terrific. Our very own Dr. Reggie Robinson is going to be on with one of our Go Red ambassadors, Gail Harris-Berry. And her story is incredibly compelling and speaks to everything that Dr. Wyche is saying about what you should do and how to advocate for yourself. We have on February 14th, Valentine's Day, we have our Women's Board Affair of the Heart digital luncheon and fashion show. Women can join the event and learn about heart disease and all the research that was funded. and how important it is to continue to fund research for women in heart disease, as well as to get women into research studies. And of course, there'll be an incredible fashion show by Bloomingdale's where everybody will be rocking the red. And Dr. Wyche will be at an event tonight. Dr. Wyche, do you want to talk about that as well?
So for this evening, we have the AKA Pink Goes Red event. And so, as you know, AKAs traditionally wear pink, but we're asking them to wear red tonight because, again, we're trying to focus on specifically empowering women to take charge of their health. And whatever small little changes that you can make, those contribute significantly to decreasing your risk for cardiovascular disease. So we'll be talking about some of these same topics in terms of what are the risk factors and how you can control them? How can you empower yourself to have better health?
This
And
is
Denise,
great. Go ahead, Soula. Go ahead.
I was going to say, we have wonderful events throughout the year. We have a heart walk, which in the non-pandemic times is about 10,000 people in the National Mall. It's free. We want everyone to walk. And even during the pandemic, you can walk where you are. We have a 5-10K race. So if you're a runner, you can run. We have a golf tournament if you golf, a heart ball. And these events are really to spread the message about the fact that heart disease is the number one killer of men, women, and children in this country, and to raise funds for all the incredible research that we're funding, as well as the local programs in the community. We've been working across advocacy in Maryland, Virginia, and DC. We were able to pass hands-only CPR legislation in all 3 regions. We work across nutrition and food insecurity. And last year alone, working with our community-based partners, we fed over 7,600 people, patients, and workers healthy food. And we certainly work across blood pressure management. Dr. Wyche has done so much work for us with our federally qualified health centers, and certainly during this time of the pandemic, to get virtual information out to clinicians and people about how to manage your blood pressure.
Wonderful. I am so glad that the two of you joined us today. Dr. Wyche, my last question. When folks finish watching us today, if there's just one little thing, I mean, we talked about movement, so I think that's important. Folks need to get up off the couches and the chairs and whatever and do something, right? Just start moving. And maybe that's your answer. What is that one thing someone can do that will really benefit their heart right now?
Movement, absolutely. That is definitely it. Physical activity does everything that you want it to do. It basically decreases your risk for anxiety. It decreases stress. It's a good stress management. It's great for the heart. American Heart Association recommends 150 minutes per week. So that's just 30 minutes 5 times out of the week. And it actually improves your lifestyle. So, I mean, actually, you live longer when you exercise, and you can incorporate the music with it. That helps exercise go a little bit faster, for me, a little bit better. So definitely and you don't need anything. So you can get a pair of tennis shoes and go for a walk. Well, not for today. It's a little rain. You can get a pair of tennis shoes and just
Right. Well, I was going to say it's Black History Month, so go pull out some of those oldies but goodies and practice up on those old steps that you used to do so well and kind of forgot. Don't do any. What was the one, the good foot or anything like that you might trip and fall. But
do some line dancing.
The twist will work, right? Or line dancing. But remembering some blasts from the past. Thank you so much for being with us today, for reminding us of the things that we can do to maintain a healthy heart. And hopefully, Soula, is that walk going to take place this year?
Yes, it is. We're going to have the walk in November. And listen, you can walk anywhere, anytime. That's what Go Red for Women and this theme is all about. Walk around the block,
walk
the dog, take the stroller, do whatever you want, but just try and get in 20 minutes every day if you can.
I say grab a friend and go take a walk. We've been doing a lot solo the last 2 years. So right now, I think we can grab a friend and get ready for that big walk in November. thank you all so much for joining us.
Thank you. Thank you for
Thank
having
you for
me.
having us.
Happy
We
American
appreciate
Heart Month. Let's keep those hearts pumping. All
Right.
righty. Thank you.